Hospitals and many other healthcare facilities operate 24 hours a day, 7 days a week. They must be ready to respond to emergencies day and night, around the clock, on short notice. As we begin this course called What's Different About Working in Healthcare Facilities, it's critical for you to understand that your actions will have a positive or negative impact on patient care.
Some patients will have a short recovery, while others may be bedridden with compromised immune systems and recovering from life-threatening injuries or illnesses.
You may be working on a new construction, a renovation, or a routine maintenance project. It doesn't matter what type of work you'll perform, but what does matter is that you have the knowledge and training necessary to work in a healthcare environment.
The purpose of this training is to prevent your actions from negatively impacting patients, hospital staff, and visitors. Patients and their families demand high levels of care, excellent customer service, and professionalism. But construction and renovation projects often lead to patient dissatisfaction. Your actions directly impact their comfort and even their ability to recover. Construction can also lead to dissatisfaction among healthcare staff as well. Clinical staff may be frustrated if they are unable to properly care for patients. We know construction will be inconvenient,
but disruptions due to your lack of training are unacceptable. In some cases, if you are an employee of an outsourced contractor, you might be asked to leave the worksite, which could jeopardize your employer's contract. Disruptions due to lack of training are also unacceptable, even if you are a member of the hospital maintenance staff. Your lack of training could lead to an uncomfortable confrontation with your department director.
Patient satisfaction has always been important in healthcare, but it took on a whole new meaning with the introduction of HCAHPS in 2006. HCAHPS is an acronym for the Hospital Consumer Assessment of Healthcare Providers and Systems. This system created a survey for recently discharged patients to rate their experience during their hospital stay. In 2008, the scores from these surveys became public information.
The survey has 11 dimensions. 2 of these dimensions are cleanliness and quietness of the hospital environment. A contractor employee or maintenance staff member working on projects in healthcare facilities may impact how patients rate the hospital. You must do everything reasonably possible to prevent a negative rating.
In March of 2010, the Affordable Care Act, also known as Obamacare, was signed into law. The scores from patient surveys and the Affordable Care Act result in pay for performance for healthcare providers.
It's important for you to understand that your actions while working on a construction, renovation, or maintenance project in a healthcare facility can impact that facility's income. Patient satisfaction is now connected directly to hospital funding.
Patients and their families expect medical care in a healing environment when they enter a healthcare facility. The healthcare industry calls this the environment of care. There are 3 components of the environment of care: the people, the building, and the environment. Good management of these components ensure that patients, staff, and visitors have a safe, functional, supportive, and effective environment. One look at this picture, and you can probably guess right away who's responsible for ensuring patient safety. That's right, we are all responsible. Patients depend on all of us to keep their environment clean and safe. Again, always remember patient satisfaction and the hospital consumer assessment. You have arrived at the first checkpoint. There will be several checkpoints to test your knowledge throughout the training. Answer the following questions. If you answer incorrectly, the correct answer will be given to you to better help you comprehend the principles addressed in the program.